the methods of birth control? Alright, let us have a quick recap. The birth control methods include natural methods, barrier methods, intrauterine devices, oral contraceptives, injectables, implants, and surgical methods. You are well aware of the mechanism of action, isn't it? Alright, so let's move ahead, and in today's module, we will study about medical termination of pregnancy and sexually transmitted diseases. So let us first discuss medical termination of pregnancy. Now I'm sure you must be thinking that what is this medical termination of pregnancy? So students, as the name suggests, the intentional or voluntary termination of pregnancy before its full term, this is known as medical termination of pregnancy, or in short, MTP. And it is also known as induced abortion. Now students, do you know that nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts to 1/5 of the total number of conceived pregnancies in a given year. Therefore, MTP has a significant role in controlling the population. Although we must understand that this is not meant for that purpose. MTP has been legalized by Government of India since 1971, but that too with certain conditions to avoid its misuse and protection on illegal female PT sites. Now, students, you must be wondering that why are MTPs done? So the answer is to get rid of unwanted pregnancies, either due to casual, unprotected intercourse or failure of the contraceptive used during coitus or rape, as well as in cases where pregnancy could be harmful or even fatal either to the mother or to the fetus or both. Now students, here I have a question for you all. Do you know when is MTP performed? MTPs are considered relatively safe during the first trimester, up to 12 weeks of pregnancy. Second trimester abortions are much more riskier. But the problem associated is that majority of the MTPs are performed illegally by unqualified professionals, which are not only unsafe, but they could be fatal too. Now students, do you remember amniocentesis? Right, that is the use of amniotic fluid to determine the sex of the unborn child. Sometimes amniocentesis is misused and is followed by an MTP, a female feticide. Thus, effective counseling will be needed to avoid unprotected coitus and the risk factors involved in illegal abortions, as well as providing more healthcare facilities could reverse the unhealthy trend associated with medical termination of pregnancy. So, did you ever wonder that reproductive health has such an importance? Alright students, now let us understand sexually transmitted diseases in detail. So here comes an obvious question. What are sexually transmitted diseases? Well, the diseases or infections which are transmitted through sexual intercourse are collectively called sexually transmitted diseases or venereal diseases or reproductive tract infections. Some of the commonly sexually transmitted diseases are gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course, the most discussed infection in the recent years, HIV to AIDS. We will look at their causes gradually. Now, out of several diseases, hepatitis B and HIV can also be caused by sharing of injection needles or surgical instruments with infected persons or transfusion of blood or even from an infected mother to the fetus. Except for hepatitis B, other diseases are completely curable if detected early and treated properly. Now, students, let us see what are the symptoms of these diseases. Well, the early symptoms of most of these are minor issues, which include itching, fluid discharge, slight pain, swellings, etc. in the genitals. Sometimes the infected females may be asymptomatic and hence may remain undetected for a very long duration of time. Sometimes the absence of symptoms and restrictions signal damage to sexually transmitted diseases, affected persons from going for timely detection and proper treatment, which can further lead to complications including pelvic inflammatory diseases, abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. So you must have understood till now that prevention and cure of these diseases are equally important like any other disease. Reproductive healthcare programs also take care of these diseases. You will be surprised to know that although all persons are vulnerable to these infections, their incidences are reported to be very high among persons in the age group of 15 to 24 years. Do you belong to this age group as well? Don't panic. Prevention is still in your hands. So the prevention of reproductive tract infections include avoiding undetected and multi-partner intercourse. In case of a doubt, one must go to a qualified doctor for early detection and get complete treatment if diagnosed with the disease. Students, in this module, you will learn about medical termination of pregnancy and sexually transmitted diseases. In our next module, we will understand about infertility, which is yet another important aspect of reproductive health.